You need to know about brain stroke and how to prevent a stroke. What is a stroke? A stroke occurs when a blood vessel in the brain ruptures and bleeds, or when there's a blockage in the blood supply to the brain. The rupture or blockage prevents blood and oxygen from reaching the brain's tissues. Stroke symptoms. 1. Weakness in the arm, face, and leg, especially on one side of the body. 2. Lack of responsiveness. 3. Slurred speech. 4. Trouble speaking. 5. Trouble walking. 6. Dizziness. 7. Sudden headache with an unknown cause. 8. Seizures. 9. Nausea or vomiting. A stroke requires immediate medical attention. If you think you or someone else is having a stroke, prompt treatment is key to preventing the following outcomes: brain damage, long-term disability, death. The cause of a stroke depends on the type of stroke. Strokes fall into three main categories. 1. Transient ischemic attack, TIA. 2. Ischemic stroke. 3. Hemorrhagic stroke. 1. Transient ischemic attack, TIA. A transient ischemic attack, often called a TIA or mini-stroke, occurs when blood flow to the brain is blocked temporarily. Symptoms are similar to those of a full stroke. However, they're typically temporary and disappear after a few minutes or hours, when the blockage moves and blood flow is restored. A TIA serves as a warning that an actual stroke may happen. Because of this, it's best not to ignore it. Seek the same treatment you would for a major stroke and get emergency medical help. 2. Ischemic stroke. During an ischemic stroke, the arteries supplying blood to the brain narrow or become blocked. Blood clots or severely reduced blood flow to the brain causes these blockages. Pieces of plaque breaking off and blocking a blood vessel can also cause them. 3. Hemorrhagic stroke. A hemorrhagic stroke happens when an artery in the brain breaks open or leaks blood. The blood from that artery creates excess pressure in the skull and swells the brain, damaging brain cells and tissues. How to prevent a stroke. Quit smoking if you smoke. Quitting now will lower your risk of stroke. You can reach out to your doctor to create a quit plan. Limit alcohol use. Heavy alcohol consumption can raise your blood pressure, which in turn raises the risk of stroke. If reducing your intake is difficult, reach out to your doctor for help. Keep a moderate weight. Overweight and obesity increases the risk of stroke. To help manage your weight, eat a balanced diet and stay physically active more often than not. Both steps can also reduce blood pressure and cholesterol levels. Get regular checkups. Talk with your doctor about how often to get a checkup for blood pressure, cholesterol, and any conditions you may have. They can also support you in making these lifestyle changes and offer guidance. Check cholesterol. Your doctor should test your cholesterol levels at least once every 5 years. Talk with your healthcare team about this simple blood test. If you have high cholesterol, medicine and lifestyle changes can help lower your risk for stroke. Treat heart disease. If you have certain heart conditions, such as coronary artery disease or atrial fibrillation, irregular heartbeat, your healthcare team may recommend medical treatment or surgery. Taking care of heart problems can help prevent stroke. Manage high blood pressure. High blood pressure is a major risk factor for both ischemic and hemorrhagic stroke. Blood pressure, specifically systolic blood pressure, increases naturally with age. Thank you for watching. Please subscribe my YouTube channel for more videos.